Okay, well, thank you very much for inviting me here to your meeting. And I realize quite a lot of you will know quite a lot of the talk already, or probably be more expert than I am. But I find most people usually need to understand all the basics, and if you leave out any blocks, it's not always very helpful. So it sounds very grand, the Gender Identity Development Service, but basically that's been me working pro bono for the last 10 years. UCT said, well, they really support what I do, they just can't give me any money for it. So for 10 years, I am the whole service, which 64 people do in the San Francisco equivalent service. And that is a reflection, I think, on how people in management reflect on this area of importance. It's not for wanting of asking for more resources. So generally I'm going to be talking today about the gender terms briefly that I think a lot of you are familiar with. The incidence of transgender, how many of these young people are we expecting to see? The causes of gender diversity, why are people gender diverse? Coexisting, psychopathology, what sort of other issues do these young people have? And then most importantly, what do we actually do about helping young people with gender diversity and the outcomes? So I'm this gender-break person, I'm sure some of you are familiar with. For some people this is far too simplistic, but for most people in society this is a really good place to begin. When I was growing up, you were either male or female, that was kind of the end of the story, very binary. But all four of the axes of gender are on a spectrum. And while most people fall into the poles of these axes, on one side or the other, there definitely is a spectrum. So even biological sex, which is that purple line for the body on the outside, most people have a completely male or female body on the outside, but there definitely are people that have both male and female bodies on the outside. And I work at Red Cross helping young people who are in that situation and their families think about what to do. Then we get gender expression. And how many women are wearing trousers today? Put your hands up. Okay, well that was completely unacceptable 100 years ago. You'd be thrown out of church. But of course today that's absolutely fine. And if a woman wants to go to give a talk in a suit or even just to work in a suit, that's fine. But if a man wants to go to work in a dress, well, everybody gets hysterical and starts referring them to me. But actually, it doesn't necessarily signify mental health problems, it's just gender diversity. And at a school level, we have the same thing. Generally, girls are allowed to be tomboys, which, have a more masculine gender expression in the toys they play with, do they like to hang out with the boys or the girls, and how they like to dress. But a boy who has more feminine gender expression, what are they called at school? Well, there isn't really a nice term. Maybe sensitive is about the only nice term. But let's be realistic. In the playground, they're called gay or morphe, which isn't actually about gender expression, but you can immediately tell how uncomfortable people are if a boy has more feminine gender expression at school age. Then we get sexual orientation, which, as you know, is also on a spectrum, that red line from heterosexual to homosexual. But of course, there's bisexual and a whole spectrum. At school age, if a young person says they're bisexual, it usually means they're gay or lesbian. It's just much easier to be bisexual. But of course, some people are bisexual. But really what I'm going to be talking about mostly today is gender identity, which for most people in society is pretty strange because they're born with a body and that body kind of feels right for them in terms of being male or female. It might be too big or too small or somehow imperfect for them, but the actual gender, being male or female, is not an issue, which is where our big problem is in this area, because most people have never thought about this issue. But this is what we're really talking about in being transgender, which by young people who feel their body isn't in line with who they are. And even very young children will point to their heads. They say, I'm a boy, but up here I'm a girl, or the other way around. And interestingly, as I'm going to show you, this is actually where gender is in your head. And of course, there's a spectrum. People use different terms. Genderqueer or non-binary is somewhere in the middle. But it's very important to know these terms change all the time, particularly with young people. And even if someone says they're transgender, I will ask them what they mean by that. Because transgender could mean anything from 51% the opposite gender to 100% the opposite gender. And while most of these kids used to present feeling they're 100% the opposite gender, increasingly I see non-binary and people on the spectrum. And even that spectrum is two-dimensional, you know, it's kind of a line. But actually some people have different ways of identifying, and they don't like being labeled on a spectrum. So it is complex, but I think being open to being educated is really the key to all of this. Gender diverse youth think about these issues for a very long time, and before they usually see a professional, and they're very ready to educate us. And we learn so much from just asking, what does that mean to you? And please help me understand. But the terms I'm going to be using in this talk are generally all non-pathologizing terms, which are helpful to use. So in terms of trans boy or trans girl, you think about where the bus is going. You know, if you feel you're a boy, the last thing you want to be called is a natal girl, because it's got the word girl in, which isn't really what you identify as. So trans boy or trans girl, as in thinking about what the gender identity of this young person is. And I'm sure you know what cisgender is. That's in line with your gender identity. So how many of these young people are there? We used to think this was incredibly rare. 1 in 10,000 for trans girls and 1 in 30,000 for trans boys. We now think it's closer to 1 in 200. This means every school, unless it's a very small school, is highly likely to have some transgender youth. And all over the world, we're seeing a massive increase in referrals to clinics. When I started the clinic at Red Cross in 2012, I'd maybe see 1 young person every 6 months. Now I'm getting 3 referrals a week. And basically my private practice, that's pretty much all the new patients I see, and I can't see all of them. So we're certainly seeing what people are seeing all over the world. We think the reason for this massive increase is the effect of internet and media. Diverse young people all over the world are coming out at much younger ages as a result. Now, before you rush home to switch off the Wi-Fi, in case your children are going to catch this thing, what you need to understand is that actually they're not catching it from the Wi-Fi or the media. They are just finding the language or understanding who they are, and very importantly, learning that they can get help through healthcare providers and others, and this has a massive influence on their future prognosis. They have a much better outcome if they get help when they're young. Most coming to me, particularly the younger ones, identify as the opposite sex, but as I said, there's a whole spectrum of how they might identify in terms of gender identity. But what's really important is, what do they actually want to do about this? You know, do they want hormones? Do they just want a social transition? What do they actually want? Very importantly, is to be aware of the so-called causes of gender identity. 20 or 30 years ago, people like me, psychiatrists and psychologists, they used to blame the parents. They used to think that the parents had somehow been too liberal or somehow did something wrong to cause these kids to be like that. It's a terrible thing to do to parents. In fact, in psychiatry, it started with schizophrenia. There was something called a schizophrenic mother and a distant father. We know now it's 1% of every racial group gets genetic schizophrenia. And then they moved on to gays and lesbians, and no one does that nonsense anymore. And then this relative backwater of child and adolescent transgender or gender diversity. And actually the first 20 years of research was all on what the parents did wrong. Not on how really to help these kids, but and they look at families who maybe had 5 boys, and now the youngest one feels that she's transgender. Did they maybe want a girl? Well, of course they did. They had 4 boys already. Who wants another boy? But let's be serious, that doesn't mean they did anything differently. So they would research, did they treat the child any differently? And basically, after 25 years of research, they could not connect one thing to parenting. And although that research is very pathologizing, I do talk about it a lot, because a lot of parents who come to see me are worried. They let the children play with Barbie as well as trucks, and did they somehow do something terribly wrong here? And I can reassure them it's absolutely nothing to do with parenting. That even if they know that, their parents might think that they weren't good enough parents, which most grandparents think, or somebody else, at school, they know they're vegans, so clearly they did something to their children. You'll be surprised. As long as somebody's different from you, people will find another difference in you to blame for that difference if they're feeling uncomfortable. But so I make a big meal of this issue. And the talk I'm giving to you today is pretty much the talk I'm a traveling circus. I give this to school teachers, to parents, to professionals, and as Grayson was saying, my colleagues, I wasn't taught in this area. No one was taught in this area. So I give pretty much the same talk to everybody, and they need to know that, because you can't believe how alive and what prejudice is in terms of anyone who's different. So where does it come from, if it's nothing to do with parenting? We do have evidence today that this is a biological thing. The first hint we got for that was something called congenital adrenal hyperplasia. Those are women carrying a female baby, XX chromosomes in their uterus, and they just happen to have a higher level of testosterone while they're pregnant. Now, it's not like women don't have testosterone and men don't have estrogen and progesterone. We've all got all 3 of those hormones, but it's the relative level of the hormones that seems to be important. Anyway, those babies are born female, but their external genitalia are a little bit enlarged and their bodies are slightly different in that sense, but their bodies settle down to basically be typical female bodies as they grow up, and certainly by adulthood. But a much higher proportion of those birth assigned female babies identify as being male or transgender male. So that was the first hint that health people got, that this was maybe not just parents screwing up their children, maybe this was a biological thing, and the exposure to a slightly different level of testosterone while the moms were pregnant, affecting the developing brain. And today there's a huge amount of research into the differences between men and women in terms of their brains. Not just for transgender reasons, but people are interested. Women seem to be better at multitasking and men seem to be better at other things. The research is still pretty basic, and the sort of things we're looking at is things like sizes of the different parts of the brain. We know there are different areas like the visual center, the motor center, and other parts. And they do studies on large amounts of cisgendered men and cisgendered women and look at those. And basically the majority of the parts you can't tell statistically are different. But there are certain parts that are either bigger or smaller depending on whether you're male or female. Statistically, scientifically different. And then from that, they make a female pattern for the brain and a male pattern brain in terms of sizes of those particular parts. And if you take a group of transgender women and you do the same thing and measure those parts of the brain, they follow the typical cisgendered woman's brain size pattern. That's huge. And I hope you all understand that. Because what that is saying is, with the best science in the world, when somebody comes and says to a professional, I don't know why, but either since as long as I can remember, or certainly since puberty, this body has felt completely wrong for me. And, I feel I'm a woman, not a man, or the other way around. We need to take it seriously. We can't just look what went wrong with their parenting, or are they screwed up, or whatever the problem is. Probably their brain, to the best ability we have as scientists, is the opposite sex brain. And that has all sorts of human rights implications. Kind of sad that we have to get to that level. It's a bit like doubting Thomas and Jesus, that he actually had to feel the wounds in Christ before he could believe anything. But the reality is, for many, basic human beings that we are, this evidence, I think, is very helpful in understanding and sobering that we need to stop just gaslighting transgender people and actually take them seriously. So what are the other issues young people present with? Typically, the more younger children have somatic problems, things like headaches or tummy aches, and you don't have to be just transgender for that. If you're unhappy as a child, you don't go to your teacher and say, I'm feeling unhappy today. They generally have a headache or a tummy ache. And it's very important to note that kids that are saying those things, it's not like they're making it up. They really are feeling pain in that way. But anyway, that's the younger ones, and then more emotional and behavioral problems, and certainly school refusal is a big one. A trans boy who's been forced into a dress every day at school feels extremely uncomfortable and doesn't want to go to school, because at least at home often they're allowed to be themselves more. And there's huge amounts of bullying and challenges at school, which is very binary in many schools still in South Africa. And often it's not even the peers, it's the teachers. Some of the kids tell me are actually the biggest problem, being humiliated in front of the whole class because of how they might choose to present gender-wise. And then as they get older, full-blown anxiety and depressive illnesses. And why this area is particularly so important is, if we do nothing, which is essentially what the health services used to do, by the time they're 18, 50% of these young people will have tried to kill themselves. That's really scary. We have nothing in psychiatry where a relatively small group of children, 50% of them will try and kill themselves by the age of 18. And I would argue this is why these seemingly radical protocols are in place today, because we had such a serious problem. So what do we do about helping these young people? Well, firstly, I'm just going to mention what used to be done. Essentially, these children used to be given talk therapies to try and make them more comfortable with their bodies. And, if that worked, I wouldn't necessarily get in the way of it. But unfortunately, anyone who actually scientifically studied those talk therapies had to admit that basically they don't work. Any therapy to change sexual orientation or gender identity, if you study it scientifically, you can't change it with talk therapies. And that form of therapy causes enormous damage to young people, which is not difficult to understand. Many of those young people desperately want to be straight or cisgendered, and everyone's encouraging them to do that. And if you go week after week and basically, it's not working, you start to feel very bad about yourself. And many of those kids end up killing themselves because they can't change. Some of them aren't too stupid and they pretend they've changed. If you're going to therapy to make your big ears small and everyone's stupid enough not to notice that they're still big, they get out of therapy and say they're not cisgendered and straight. But actually, if you measure them 5 years later, they're still exactly who they used to be. Anyway, so that was seen as not helpful. And it's important to know a couple of other facts that people already knew 25 years ago. Unfortunately for transgender people, if they only get the help much later, and certainly in the old days, but I wouldn't say it's that much different today, most people only got help in their 30s and 40s in terms of getting what the resources they need in terms of hormones and surgeries to bring their bodies in line with their gender identity, because they needed to earn the money. You know, you can't suddenly, aged 18, afford all these hormones and surgeries. And if you wait until much later in terms of your body's development to get those helps, it's much harder to fully pass as being male or female in the gender that you identify as. And unfortunately, about half of those adult people look somewhere in between. And I say unfortunately because usually the aim is to fully pass as male or female. And if you identify as fully male or female and you look somewhere in between, unfortunately, even in the liberal city of Cape Town, that condemns you to a lifelong problem. You walk down the street and people scream morphe or tranny at you. You might even be correctively raped. You can't get a job. You know, if you try to be a teacher, nobody wants their children taught by somebody that sort of looks in between male and female. You can't get front of desk work at a hotel. It's really appalling what people do to transgender people in terms of disenfranchising them and alienating them from our society. And as a result, studies show that about 40% of transgender people hang in there who have this help later, but about 40%, once they've had all their hormones and their surgeries, that 40% try and kill themselves. So this is a terrible prognosis, if I put it bluntly, when you have a 7-year-old or somebody who's presenting like this. And what we also knew 25 years ago was if at Tanner stage 2 of puberty, a young person was saying, I identify as the opposite gender, or I'm a girl, I'm not a boy, Tanner stage 2 is very early puberty. There are 5 stages of puberty, so Tanner stage 2 is right at the beginning. If at that stage a young person is saying that, 90% plus, it's never going to go away. Which is a very important point because, you know, health professionals are very worried about getting involved and doing things if this child was going to lose their wish to be the opposite sex. Anyway, so basically 25 years ago, a group of Dutch clinicians in a clinic in the Netherlands started to see what else they could do other than just wait till 18 and watch these kids get more and more distressed. So they started to give hormone blockers at Tanner stage 2. Now, Tanner stage 2, as I've explained to you, is already when 90% would continue into adulthood to identify as transgender. And the hormone blockers, they weren't totally new. Doctors had been actually giving them for years to girls maybe age 6 who have precocious puberty. You know, they start menstruating and going through puberty age 6, which doesn't have a very good mental health outcome. All the hormone blockers do is they put puberty on ice, they just stop further puberty or development, and then they stop them age 10 or 11 whenever the other girls in the class are also starting to go through puberty, and the little girls do absolutely fine. They develop. So they weren't that radical. Doctors had been using them for years. And what they found is if you put transgender youth, and these young people are often very distressed about their bodies developing, or invariably are, their suicidality goes away. They won't kill themselves anymore if they are put on hormone blockers. Some people find that a bit hard to understand. I mean, why would someone kill themselves just because, you know, they feel they're in the wrong body? And what I say to people is, if you're a man here, imagine you start to grow boobs. Not just man boobs, but serious breasts. And if you're a woman, imagine you start to grow serious beard. Not just a little bit of whisker of auntie so-and-so, but like a big bushy beard. And, you start to ask, say to your friends, this is really distressing you, your family. And they say, you'll get used to it. Don't worry, it happens to some people. Being a teenager is not easy. That's suicide-inducing for enough people. But I can assure you, if, you can't even speak about this to most people because of the way they react to you. Most of us would be suicidal within 3 days, knowing that I'm never going to be happy with those breasts, and why did this have to happen to me, or the beard? And so what we see is if these young people are put on hormone blockers and they at least know they won't get any more male or more female, they won't kill themselves. They're not happy with their bodies, but they're hugely relieved. And I certainly see that. I see teenagers from inpatient psychiatric units, and if you get them on they finally admitted to a therapist on inpatient, this is actually about my body after the second overdose. I just can't stand my body and I just don't know what to do, but these breasts are driving me crazy. You put that person on hormone blockers, they've got hope again, and they won't kill themselves. So that's the first thing they found out. But then they had a slightly different problem. Some birth-assigned girls go through puberty pretty young, and you leave them on hormone blockers from age 10 to 18. All their friends are going through puberty. It's not helpful to be sitting with this little child's body. So age 16 instead of 18, they started to give them cross-sex hormones. And basically, if you birth assigned female, the testosterone, and if you birth assigned male, the estrogen and progesterone. And obviously, you can't do something this crazy to children without measuring the outcomes. It would be totally unethical. And the sort of things they change are body fat distribution and hair, and also voice. Within 2 or 3 months, if you birth assign female on testosterone, your voice usually drops. And and these are very important things, because when we look at somebody, we've never been taught to do this, but we're all incredibly good at it. Just looking at a face, even if you take the hair away, in under a second, we all can say that's a male or a female with a very high degree of accuracy. Kind of like recognizing an elephant. Once you know how to do it, you can't really say what you're doing, but the face is even more specific. And that's really what transgender people need. We treat men and women completely differently. I like to think I'm liberal and I treat everybody equally, but it's not true. I will subtly treat women and men differently just because the way I've been conditioned to treat people differently ever since I was born. And if you are feeling the opposite gender from how you look, you will pick up on those differences all the time. And that tends to be what young transgender youth want. They want to be treated as the gender they identify as. And for some of them, that's the most important thing. I've even had young people who say, you know what, my genitals or my body doesn't actually bother me that much, but it's being treated as the wrong gender the whole time. That totally makes me suicidal. Anyway, as I said, you can't do anything this crazy without measuring the outcomes for these young people. And essentially, there were 3 big outcomes. If you get the hormones early enough, the hormone blockers and then the cross-sex hormones, these youth in the study completely look like the opposite gender. And I didn't realize how successful this was until I got in the area. I thought you're either born male or female. You can't really look like the opposite sex. You can. When we do that gender recognition, we're not looking at genitals, we're looking at faces and body outlines. And that's basically what the hormones change. Number 2, these young people were very happy and well adjusted. And even 25 years later, that's still looking like how they're doing. That's huge. you have to reflect back. This was a group that we knew by 18, 50% would try and kill themselves. And that's just the tip of the iceberg. There's huge amounts of anxiety, depression, unhappiness as well. And number two, another 40% later on in life, when they finally get the help, still aren't happy and try and kill themselves. Basically in medicine, we don't only look at the risks of doing something. You have to look at the risks of not doing something. And the risks are completely overwhelming in this situation. So even though some people might think this is radical, it is completely unethical not to offer hormones to young people who identify as transgender. And lastly, none of these young people in the Dutch studies ever wish to go back to their birth-assigned sex. Because even if it was 5%, I probably wouldn't be giving this talk. Because doctors are very conservative people. You know, that's why they do medicine. Because they're so conservative, they want to be sure they're going to pay for their children's school fees and have a house and a car and stability. You know, their scary brothers or sisters do business or finance where they risk everything. But yeah, so we do not want people coming in 5 years later to say this was a terrible thing we've done to my child. And also, particularly if you're in child medicine or psychiatry or pediatrics, you're also quite ethical and interested in helping children because you make less money doing child psychiatry or pediatrics on the whole. So you really don't want to be causing problems. So even if it was 5%, I don't think we'd have these protocols. The evidence is overwhelming, maybe 1%. But even then, I've seen over 150 of these young people now. And I've had 3 trans boys who came and said, having been on testosterone for a while, they now identify as a bit more non-binary. They're really thrilled to have their voice on a more lower level, what the testosterone did, but they just want to stop taking the testosterone now. And that's their gender journey. And I think medicine really needs to be non-paternalistic, not telling people what they need to do. You have to listen to your patient. And they are thrilled with the changes they've had, but I don't see that as a bad outcome. The right-wing press will report these as desisters or people who have reversed. The truth is, most desisters that you read about, in fact the vast majority, are people who only had this help as adults. And what happens is you have a trans woman who doesn't look fully as a woman and is being abused every day of her life. You know, either being called bad things or in bullies. You know, some granny comes up and says, have you got a penis or a vagina? You know, it happens. You know, that granny is not an evil person. But gender goes very deep inside us. And when we see something we don't know, we get disinhibited and we start asking inappropriate questions. So that granny goes home and is mortified that she asked a complete stranger that question. But actually for the transgender person, it's horrific. Not only abuse, but constant barrage of inappropriate questions. So some of those people say, you know what, I'm not a man, but I'm just giving up. Because it is so hard pretending to be a woman or trying to pass as a woman. Those are the desisters. They didn't get help early enough for what they really needed, in my book. So essentially, when the Dutch study got these really good results, it became unethical not to offer young people these hormones all over the world. And that forms the basis of the WPATH guidelines. Essentially there's an organization that collects all the evidence from all over the world and puts them in guidelines. And everything I'm telling you today must come from the guidelines. And I make a big deal of that because, you know, as a parent, this is a big step to take. You know, and you don't want to go to some crazy liberal doctor who's going to tell you to take your child because the last 3 kids he saw was helpful. You want to be sure you're going to somebody who's going to give you the evidence of what's really going to help your individual child. So they're very helpful, and I'm pleased to say we have South African guidelines today, PATH SA, which is the equivalent, and their guidelines are pretty much the same, if not more liberal and more, diversity focused. And we've certainly had clinicians who are transgender and gender diverse working with us to draw up those guidelines. We're running out of time, but I feel that everyone else stole my time, so I'm just carrying on. So what do the guidelines say pre-adolescents need? Essentially, the families need psychoeducation and support. So I do a big one-stop shop, and I started this in Red Cross. I was a little intimidated because at the Tavistock, the big centre in the UK, they get 10 sessions to work out their gender identity before considering hormones. Well, I didn't have 10 sessions. I live out in the Boerland to come in pro bono, come and sit with the family, for 10 sessions. And it's totally unnecessary. Transgender youth are abnormally advanced. They'll tell you within 5 minutes what their gender identity is. All 4 of those axes, even kids as young as 7, will tell me in age-appropriate language. I've seen 2, 3-year-olds, and they could also do that. Basically, all you have to do is start the talk by saying, the assessment, what is your name and pronouns? And even if they don't tell you, that's a signal that actually you know what you're talking about, and you're going to listen to them. And then I first take a history from the parents, and then I see the child on their own, and I say, listen, I'm here not to change you, but help your parents understand who you are and get what you need. And I take a gender history. The gender history is mainly there for the parents to be able to tell them, actually, they didn't catch this in the pride group at school. They were already having these feelings in grade 2. In fact, in grade 1, when they were forced to go in a dress to school, they couldn't understand, and they were told to stand with the boys and not the girls. They thought they were a girl until that happened. Anyway, families need psychoeducation and support. An assessment is 4 to 5 hours. That basically, I find, because people need to travel, it's important to have the whole thing done in one stop. And I often say, listen, are you exhausted? Do you want to come back another week after 2 hours? No, they want to just get through the whole thing there and then. The children themselves just need observation and support. They do not need any hormones or any surgeries. I mean, press every now and then get very excited and say, doctors are operating on children, and it's absolute rubbish, or giving hormones to children. We don't give any of those interventions until you're already in puberty. Ideally, though, children should be allowed to express themselves freely in all their different environments. And this is the controversial thing, a social transition. You've heard it probably in the last week or two, the hysteria from the right wing about toilets. Basically, a social transition is changing the obvious stuff, and usually it's at school. Name, pronouns, school uniforms, toilets, changing rooms, and sports. Basically the things that make you male or female. And Ron Adenall started this work before me, that essentially we were seeing so many of these youths that if I'm involved, I get involved with the school. And the first thing I do is to offer to give them a talk, the same talk I'm giving you largely, and then I help them with how to communicate with parents and the youth around this. What do you think are the 2 most controversial on this list here in terms of changes? Right. Toilets is number 1. Everyone, including Donald Trump, is very worried about the toilet situation. So let's look, and you have to unpack here. That's completely a misunderstanding of what's actually going on. Most of the transgender youth I see are completely disgusted by their genitals. Birth-assigned boys or transgender girls usually don't even masturbate. They are so disgusted by their genitals. And if they are lucky enough to be in a relationship, they usually don't allow their partner to even touch them in any erogenous zone. And what people are really worried about in the toilets is my daughter is going to have sex with that boy in the toilet. That's really what they're worried about if you peel it away. They're worried about their own child's safety. They're not worried about the transgender youth. And the second thing is, so firstly, they're the last people that are going to allow anyone to touch them in an erogenous zone. Secondly, most transgender youth just want to be a boy or a girl. They don't want to be the transgender person, you know, the big activist in the school. Not that there's anything wrong with that. Certainly, there's a great place for that. But most of them, 80% of the ones I see are also on the autistic spectrum. And that means socially, they do not like attention. They just want to get on with their lives. It makes them very anxious having everybody stare at them and ask them too many questions. So basically, if they are lucky enough to go to a toilet that has the label of their gender on, they're going to be the last ones to do anything to bring attention to their bodies being different. And I kind of say that, you know, your daughter is more likely to be hit by a meteorite in the toilet than have sex with a transgender boy. You need to worry about the gays and the cisgenders. They're far more scary. Not really the gays, but, you know, they're other potentials. Anyway, we have over 60 schools now where either Ron or myself has facilitated things, not one incidence of bullying in any of them. And I'm not going to spend a lot more time, but the youth today are amazing. Not just Westerford and liberal schools. I've worked with very poor schools, very verkrampt schools in the Boiland, where I mostly work. It works in all of them. All you have to do is give people the right facts, the facts that I'm giving you this morning, and they get it. Teachers tend to be quite nice people. They want to do good things. I also talk about, well, I've given you the stuff on hormones, so I'm not going to go over that again, but I also talk about religion, because for many families this is a very important area, and we are meant to talk about religion. And I find most of the problems there just come from misinformation. People don't realize the facts. So in terms of the Bible, does anybody know what the Bible says about transgender? It says nothing. You're all right. So basically, what happens is there's this LGBTQI thing, and the fundamentalists advertise, you know, that the gays are particularly evil. So many religious people think that all the others in that word are also quite evil. Well, actually, you know, if you do look at the gay, there are 5 references in the Bible. The most famous one is Sodom and Gomorrah. And in Sodom, there were gay men raping straight male angels. Well, even gays today will tell you that's not on. You know, you don't go around raping straight angels. It's not a nice thing to do. But there were no transgender people on the scene, not one. And so really, you know, don't draw inappropriate conclusions. What the Bible does mention is hermaphrodites. And hermaphrodites are essentially intersex. They're people with male and female bodies. But it doesn't tell you that they are evil or should be stoned to death. It just mentions them. And in my mind, if you reflect on what we know today, transgender people are really intersex. They have the brain of one body, one gender, and a body with another gender. And even fundamentalist Christians and Muslims and whatever, the fundamentalists are the real problems. If you say to them, now what must this child do? You know, they've got boobs and a penis. Must they now lie on the beach like that? They'll say, absolutely horrific. Oh, shame. Let them choose, you know, what they want to do with their body. If they want the boobs removed or the penis removed, that's just fine. You can't expect a child to be like that on the beach. Well, actually, this is exactly the same. Somebody's got a problem, and actually your brain is the important thing, not all the appendages hanging on it. And if you choose to do something with your body that's going to make you more comfortable in society, you know, who is anybody else to get in the way and tell you what to do? And certainly there are Christian leaders, Muslim leaders that are totally supportive. And in terms of the African belief system, at the first Gender Dynamics conference I went to, there were 3 Sangomas who shared that when they come across a child who identifies as the opposite gender, they go into an assessment of the family, the community, and take a full history. And invariably they come to the conclusion that this child is a reincarnation of an opposite sex ancestor, and they advise everybody to leave the child alone and allow them to express themselves as they feel they need to. And many Sangomas are transgender, or gay or lesbian, or intersex. And I know not all Sangomas have the same approach, but I think, certainly in the West, we don't know the full story, and we make a lot of assumptions. And while I'm not a religious leader, I just use these facts to help families if it helps them accept their child. But I'm going to stop there, so now I've talked too much.